everyone. Welcome back to another session of A Day with your fertility specialist. I'm your host, Joanna Damina, for today. Today, we're going to be talking about a very interesting topic. We're very sorry for the delay, but thank you for sticking around. We really do appreciate every time you click on our live sessions, you comment, you like them, and you share it with someone. Today, we're talking about adenomyosis. And you might know of this topic. If you've been around here long enough, you've definitely heard adenomyosis once or twice. But we're going into detail about it today. We're going to explain it a lot more today. And for that, we have Dr. Jane with us in the studio. Hi, ma'am. Welcome.
Thank you,
We've
Joanna.
missed you on here. Lovely to have you.
Nice to be here again.
It's always nice to have Dr. Jane on here. If you join us for the first time, Dr. Jane is a consultant gynecologist, also a consultant obstetrician. So she knows a lot about this topic because this relates a lot with women's health and the women's reproductive system. So yes, let's just dive into it. Let's go straight into it. So to start, Dr. Jane, could you explain to us what adenomyosis is?
Okay, so adenomyosis is one of the gynecological conditions we'll have, and it has to do with displacement of the lining of the womb
Okay.
into the muscular layer of the uterus or the womb. So we say the uterus or the womb has three layers, or called the serosa, the outer covering,
Yeah.
the inner layer, which is the muscular layer, and the middle layer, then the inner layer called the endometrium. So if we find the lining of the inner lining in the muscular layer, which is the second layer, that is called adenomyosis and can lead to a lot of complications, as we will discuss as we go forward.
Yeah, okay. Well, that sounds very similar to something else we've spoken about on our live sessions, endometriosis. So, what exactly is the difference between these two? Or is it the same thing, but, a different presentation?
Well, they are similar but different presentation, as we say. Like endometriosis is found at other sites, not specifically within the womb or the
Okay.
uterus.
Okay.
So you can have endometriosis or the ovaries, the support system of the uterus, distant sites like the lungs, the brain, and all of that.
Wow.
While for adenomyosis, it's confined to the muscular layer of the uterus. In fact, formally, or some authorities call adenomyosis endometriosis interna. That's internal endometriosis, while they refer to the conventional endometriosis as endometriosis external.
Oh, wow. So it seems like it's a bit of the similar thing, but just in a way, the location
Yeah.
based, let's say. Okay, so but what are the symptoms, or what are some of the common things that someone might come to you with if they're struggling with adenomyosis, not endometriosis, please?
Well, so for women with adenomyosis, commonly they'll present with heavy menstrual bleeding, severe painful periods, intense pain, painful
Wow.
periods. They can have also chronic pelvic pain, and also infertility is one of their presentations.
Wow, that's like it goes from 0 to 100 really quick. Oh wow, that sounds very tough and very difficult to um how do I say manage or to pinpoint, right?
Yes.
So how does a person know that this is not just painful periods, like this is something that needs to be looked into?
Well, so there are some risk factors that you would expect. So, like adenomyosis is commonly seen in women who are over 40. Yes, you can see it in younger women now.
Yeah.
Over 40, people that have had uterine procedures, fibroid surgery, cesarean section, D&Cs, and all of that. Then there are symptoms. There are a lot of other things that can come with pain, painful periods, heavy periods, and all. But now the difference is in evaluation. So someone has pain. No woman should stay with painful periods,
Yeah.
irrespective of the cause, adenomyosis, endometriosis, uterine fibroids, or whatever it is. So from evaluation, you can tell this likely adenomyosis, endometriosis, or whatever would cause pain. So pain should not be managed. It's not something you can sit at home and say this is the cause of the pain.
Yeah,
It has to be
exactly.
evaluated. So from your history, examination, investigations, we could come to a conclusion if it's adenomyosis or any other condition.
Okay, well, I know that most of the time is not very quickly diagnosed or it's misdiagnosed. But why does that even happen?
Yeah, because it has similar presentation with a lot of gynecological conditions. And often in this some parts of the world, maybe here, people assume that pains during period should is a normal thing for every woman.
Yeah.
But the pains have categories. There are grades of this pain. And so you miss them where you assume, because there are actually mild forms, moderate forms of all these conditions. So when you're in those categories, you might just assume they are normal things you would expect. But
Yeah.
actually, this is adenomyosis and it's progressive. So presentation is better when you come earlier. You are evaluated and probably offer treatment to prevent, because it progresses from a mild form to a severe form. That we'll see. So discuss further.
Yeah, of course. But you did mention that it also affects fertility or might cause infertility. How does that even get to that point?
Well, the mechanism, how it causes infertility, is actually elusive. It's nothing you can just place your hands on, but there are some things that have been associated, or some theories that have been like. First, we can talk about alteration of the lining of the uterus
Yeah,
generally.
yeah.
So now we talked about the lining of the womb invading the muscular layer. So now this invasion responds to the hormones that the ovaries produce every month.
Wow.
So the prostaglandins, the whole painful, all the whole process of. So you now have this uterine muscular layer not receptive to the embryo, so it affects implantation
Okay.
and conception in that way.
Mm.
Then it alters. It's also because of this whole process. It now causes excessive increase or abnormal increase in the size and shape of the uterus. So when it does that, it alters the lining and prevents implantation, conception, and all of that. It also can affect the sperm, and because of consistent, it can also cause continuous what we call movement of the uterus,
Okay.
what we call peristalsis. So affects sperm transport too, and that can also affect pregnancy rate. Then again, with the chronic pain they have, they can also have significant pain during intercourse.
Oh wow.
That alone can inhibit or reduce the frequency of intercourse for them. And also that's another way of causing infertility. Adenomyosis can also cause recurrent miscarriages for the same reason. Alteration of the bed, the muscular layer, affecting implantation. So all of these are ways that you can present with infertility at different points.
Okay, but can a woman still conceive naturally when she has why do I keep trying to say endometriosis?
Adenomyosis.
Adenomyosis. Oh my
Yes.
days. Know your topic.
Yes.
Yeah, can a woman still conceive naturally, or is the chances of, how do I say, fertility rate? Yeah, does the fertility rate actually reduce significantly, or natural conception is still
Yes.
very much okay?
Natural conception is very possible for women with adenomyosis. Adenomyosis can be categorized. You can have what we call focal
Okay.
and diffused. So now focal, we just have the adenomyotic growth just fixed in a particular position, while we can have diffused affecting the whole muscular layer of the entire uterus.
Okay.
So you see, women with mild forms, moderate forms, they can actually get pregnant naturally, while those with severe forms, for all we have listed, that might impact their fertility rate. But
Okay.
natural pregnancy can happen with adenomyosis.
I mean, that sounds like a very good thing, because, having you talk about how adenomyosis can affect everything around the uterus, it sounds very debilitating. Like, wow, can you even try to do that naturally? But it's a really good thing that you can. But for trying to figure out if a woman has adenomyosis, evaluation is important, like you said. What are some of the most common or the most accurate sorts of the means in which adenomyosis can be diagnosed? Is it ultrasound? Are there more testing to do? Things like that.
Yeah, so formally we would say that the standard way, or the only way of convincingly saying this is adenomyosis, was when you take a sample of the uterus and look under the microscope, what we call histology.
Yeah.
That is the way you can see 100% that this is adenomyosis. But now a lot of women want to preserve their fertility.
Mm-hmm.
A lot of modern techniques are coming up. So now you can even do a transvaginal ultrasound scan.
Okay.
There are a lot of things you can pick on a transvaginal ultrasound scan, and that will tell you this is adenomyosis. There are some changes, alterations you can see classically on the uterus.
Mm.
Then again, and that is readily available, is cheap, can be afforded by most people.
Yeah.
Then magnetic resonance imaging, which is also a high-tech imaging test, can also be done to make a diagnosis of adenomyosis. So some of those features you pick on ultrasound scan, you pick them on MRI. But again, MRI is expensive,
Yeah.
but are not readily available, but is still an option that can also help make that diagnosis. Commonly, those are the two things. Then the sample of the uterus
Oh, I can't
for
even.
histology.
I actually can't even imagine having to go through the point of getting a sample of the uterus because that means you have to go under the knife and then
Yes,
all of that.
because in fact that used to be the gold standard of treatment of
Wow.
adenomyosis, removal of the uterus. But now
Wow.
a lot of things can be
It has
done
gone a
to
long way.
preserve
Yeah.
fertility,
Yeah.
help women get pregnant as the journey through the challenge.
That's that's crazy. I'm just thinking about it, but I'm so glad other things like imaging, like MRI, and the transvaginal ultrasound scans have come into play because imagine every woman dealing with this having to go through another sort of traumatic event or something
Yeah,
that is a little bit more traumatizing than
it's,
an imaging.
yeah. If you do a 3D scan, in fact, to add,
Oh
a
wow.
3D scan can
Hmm.
clearly visualize we have this concept of the junctional zone.
Okay.
That's where the lining of the womb meets and the muscular layer of the womb. That's the
Hmm.
endometrium and the myometrium. So that 3D scan clearly visualizes that zone, and it can tell you alterations, changes, and those are the
Wow,
typical
that's
things we use to
interesting.
make
Yeah.
diagnosis. So ultrasound scan can do a whole lot for you.
So a lot of the evaluations used to make diagnosis nowadays is based on imaging.
Yes.
Oh, that's nice. That's really nice. But speaking about fertility or infertility generally, at what point do you think a woman struggling with infertility should be evaluated for something like adenomyosis?
Well, so I wouldn't peg a particular time to that because
Mm,
while you're evaluating a woman for infertility, so you don't evaluate the woman in isolation. We're doing infertility today. Your
yeah.
uterus should be this form. So
Mm,
while you are doing your scan, you might just pick it
mm-hmm,
incidentally and you
mm.
discuss the problem with
Okay.
her.
Yeah.
But again, someone else might come with this. So for a woman that presents with risk factors, symptoms, and conventional fertility treatments have
Mm,
failed, you might want to start looking for other options to see what is responsible for this
yeah.
infertility. So
Yeah.
at that point, you can also evaluate for infertility.
Okay.
But again, women can be evaluated anytime you see them. If you pick it, you discuss it because that can also be a problem.
Mm. So treating adenomyosis, yeah, let's get to that. At what level are we at now? I know we've gotten a little bit better with the diagnostic part, but what about treating it? Are medical treatments available? Does it have to be surgical? How do we go about treating or even just managing adenomyosis?
Well, okay, so adenomyosis can actually be managed surgically and
Mm-hmm.
with medical management. So when we say
Okay.
medical, we talk of using drugs,
Yeah.
hormones, and
Yeah.
all of that.
Mm.
Yeah, so there's an option for using hormones, drugs such as painkillers, like what we call the non-steroidal anti-inflammatory drugs. They are
Mm-hmm.
basically pain meds to manage this excruciating pain we are talking about.
Yeah.
Then we can use pills. Well, you see, for women that want this medical management, they're also classified as conservative treatment. There are people that still want to have children, that still want to conserve fertility. But
Mm.
some of these drugs too can affect ovulation, pregnancy. So when we use pills, the combined oral contraceptive pills, and all of that, they can also help reduce the response to the ovarian hormones and
Okay.
reduce frequency of periods and period pains, and
Mm.
all of that.
Mm-hmm.
Yes, we can also use what we call um, some drugs that we call, they are supposed to mimic the hormones that are produced in the brain. We call them the GnRH analogs.
Okay.
So they are supposed to be given to women to induce what we call a medical form of menopause
Ah.
temporarily, so they
Mm.
don't menstruate, they don't respond to those steroids, and their
Mm.
pains are gone. Of course, they can use some intrauterine devices hormone bearing too. Anything that will reduce period flow and all of that. Because of the heavy period, those devices can also flatten or thin out the lining of the womb, what we call Mirena, intrauterine system. That would help reduce the flow rate and also help regulate periods.
Okay. Okay.
Then we can do surgeries. Now, for the surgical options, can be laparoscopic, can also be open surgeries. So, for the conservative surgeries, basically is what we do adenomyomectomy. That means removal of the adenomyotic tissues.
Okay.
So, in bits, or some persons say resection of just taking out those tissues, those abnormal tissues, because they are hard, they are not responsive, they are not stretchy like the conventional muscular tissues. So they
Okay.
have, and that is how basically how they affect fertility. So they are, you can take them out and fix the uterus. And finally, another major surgical option for them is for women that don't desire any to preserve fertility, their uterine, their uterus, or they have completed their family size.
Yeah.
As we introduced, that this is commonly seen in older women, 40 people that have had multiple pregnancies and births. Yeah, so they can also take out the uterus, and that
Wow.
is assumed permanent treatment for adenomyosis.
Why did you say assumed? I mean, if adenomyosis is in the wall of the uterus, I think without the uterus, it shouldn't be.
It shouldn't be there.
Struggling
So
with
yes, it's seen as the
adenomyosis.
major treatment. But again, a lot of women want to conserve fertility. So now the conservative options are the ones that are in the forefront at the moment. So debulking surgeries,
Yeah.
adenomyomectomies, and all of that.
Okay, but for you as a gynecologist and the patients that you see, what point would you say you would actually recommend that your clients get the surgical treatment as opposed to medical treatment? Is there any indication here? Is there any indication for either one of them?
So firstly, so now the patients are individualized. So for a woman that her major concern is the pain,
Yeah.
the heavy bleeding and all, if those medical management would help, that's okay for her. But some other women would also want to have children, struggling with infertility alongside the symptoms. For the many things we have explained about adenomyosis and fertility, at that point we would offer her surgical option to take out the adenomyotic tissues. That gives the uterus a lot more time to respond to ovarian hormone rest from the take out those abnormal tissues in the muscular layer, and that helps to improve fertility for the women.
And can lifestyle changes manage it as well? Because I know some conditions I've been on set talking about, you might hear talks about lifestyle this, lifestyle that. Does that affect adenomyosis in any way?
Well, nothing so much for lifestyle, but again, we advocate that women remain in good health all the time. So healthy eating, reduce refined sugars, anything, because sometimes your challenges might be multi from different sources.
Yeah.
So if you can control for every other factor, most times your what you aim to achieve in your treatment, it's the success rate is a lot more.
Okay, well, that's interesting. I mean, I like that it's not just a one-stop shop that, if you have these certain changes that this would happen. But for adenomyosis, is it something that once a woman struggles with it, it is, a lifelong condition? Does it resolve on its own? Does it go away and come back? Does it get worse if it's not being treated? Things like this.
Yeah. So well, adenomyosis gets is progressive, so it can get worse if not treated.
Oh, wow.
So that is why early presentation helps with early management and reduces. So this is what happens in adenomyosis. Just like the womb, every month you grow the lining of your womb and shed during menstruation.
Yeah.
Now those endometrial tissues that are in the muscles, they respond to the ovarian hormones, they grow. So but what they do, they remain there and just they keep increasing the size, altering the. So imagine you have that going on for years, and so it keeps responding, and that is what happens. So it's progressive. Um, so yes, you might not say a woman's symptoms has resolved, it depends on her reproductive wish or her challenge at the time.
Yeah.
So treatment also depends on what the person's problem at the time is. If pain is her problem and we are sufficiently able to manage pain,
Mm.
you might not talk about adenomyosis again. If
Exactly.
heavy period is her problem and we're able to control that, that might not be significantly a challenge.
Mm.
So it doesn't go away. Then when a woman gets to menopause, obviously, because adenomyosis has also been linked to estrogen exposure, with menopause, there's reduced production of estrogens. The women, the ovarian hormones to reduce significantly. Some of those symptoms tend to withdraw, no heavy periods,
Yeah.
reduced pain, and all of that.
Okay.
So it doesn't go away, but if you manage comfortably, and that is the problem, then you've taken on that big challenge, and the client is fine.
Okay. That's nice. But speaking about fertility again, um, do you recommend, or are there points in time where you see adenomyosis and you'd actually recommend assisted reproductive technologies like IVF? Do you come across that in your, practice?
Well, yes, IVF improves outcomes for women with
Okay.
adenomyosis.
Okay.
Yes, it improves for women with adenomyosis,
Hmm.
even though the improvement is not better, is less compared to what you have in women without adenomyosis.
Yeah.
But if you do at some when a woman doesn't respond to conventional fertility treatment, she has the symptoms, you've done your debulking surgery, the
Mm-hmm.
best thing is to recommend something that should work or would work for her at the time.
Okay.
Yes, and surgeries would improve her outcome. But again, there's a risk at some point when she gets pregnant. There's risk for some uterine issues. Remember, you're
Oh.
taking off a large chunk of the uterine
Yeah.
muscle. Yeah.
Oh, wow. So, but how does it affect women in pregnancy? Since you mentioned that, let's
Okay,
actually get into it.
so you know that there's already alteration in the uterine muscular layer,
Mm-hmm.
so they can have placental challenges like morbidly adherent placenta, what we call
Okay.
placenta accreta syndromes.
Hmm.
They can also have rupture of the uterus
Wow.
even before they start to contract.
Hmm.
Yes, so those are some things you would discuss while trying for pregnancy after adenomyosis. But these are for the very severe forms.
Okay.
People that we're talking about global adenomyosis. You know, I mentioned we have focal and
Mm-hmm.
diffuse.
Yeah.
So focal is just there, so it doesn't affect much the uterine muscular layers. It's just a part of it. But the diffuse one, when you have debulking surgeries, like you're taking out an entire part of the
That's
muscular
it.
layer, so you
Wow.
have a little. So
Hmm.
there's a slight risk of uterine rupture
Hmm.
in pregnancy, but it's not always the goal. So with good monitoring, proper follow-up, a lot of women have achieved normal pregnancies
I like
after
the
surgery.
I like the way you say slight risk, so you're not really scared out there. Like if you do need to treat adenomyosis before your fertility journey or before you're trying to get pregnant, then it's perfectly fine. The risk is slight, according to Dr. J. All right. So those are most of the things that I think a lot of people are curious about when it comes to adenomyosis, and especially with trying to differentiate it from endometriosis, and just trying to know how it works, how it affects their journey, and all of that. I hope this has answered your questions quite a lot, and I hope that you're going to be more informed on this topic. If you're struggling with it, definitely do talk to your doctor or your fertility specialist if that is what you have in mind. But before we go, I would just ask Dr. Jane if you have any advice to women who are struggling with adenomyosis and are trying to conceive.
Well, so for women struggling with adenomyosis, trying to conceive, there's treatment option for adenomyosis. There's
Mm-hmm.
solution for your infertility. There's no point sitting back and assuming that is just a problem that has no solution.
Yeah.
There's solution for your problem, and pregnancy can be achieved as long as you present early and you're
Mm-hmm.
properly managed.
Okay. So present early so you're properly managed. Like we always say, when there's always light at the end of the tunnel, is not always a last stop for you. Is not your last choice. Is not the end of your whole fertility journey. What we're here to do is try to give you more options and just open your eyes to how you can actually achieve your fertility dreams and your pregnancy dreams, whatever it might be. So, thank you so much, Dr. Jane, for joining us today. This has been very enlightening, and I hope that, and I know that actually our viewers have really enjoyed this topic. So yes, thank you for joining us once again. We are live every Wednesdays and Fridays by 3 p.m. on Instagram, Facebook, TikTok, and where else? YouTube. So please do join us. We have new topics to talk about every week. Turn on your post notifications just in case you forget. Your phone will remind you about that. Thank you for sticking with us. Have a lovely day. Goodbye.